Welcome, everyone. So today we're going to be discussing how God and pharma are related. This is an examination of psychopharmacology and theology. So we're going to be looking at the connections between medical interventions and some biblical perspectives about medicine. So what is psychopharmacology? So in general terms, it's just the treatment of mental infirmity or illness with medication. And this occurs because there is a actual biological chemical imbalance between synapses. In the diagram, it shows there are two synapses are actually holding on to the neurotransmitters because they are being inhibited from crossing because there is an overproduction. So when we're looking at neurotransmitters, usually with psychopharmacology, we're only looking at four main ones, but there are other hormones that can affect chemical balances within the brain. But mostly we're dealing with GABA, serotonin, dopamine, and norepinephrine. And GABA itself is considered the calming neurotransmitter. It helps us regulate. It also has a huge effect on how we're able to regulate sleep. Then you have serotonin and dopamine. They're both considered the happy hormones or happy neurotransmitters. They often have to do with how we feel about and deal with the reward system within our brains, but they can also greatly affect the level of happiness that we have. If there is a underproduction of either of these, it's actually what causes depression. When we're looking at norepinephrine, we're actually looking at the attention and cognitive function neurotransmitters. Those are more what you see related to ADHD and ADD. But they, if not properly balanced, cause the issue of remaining attentive and being able to understand what we're doing. So again, we're looking at biological functions, and the medication is meant to address those balance issues. Now, any type of psychopharmacology is meant to reduce suffering and to aid in increasing function. This can only be done through medication when we can identify a biological issue. But it should not be the only therapy that a client or patient receives. Usually when we're dealing with medications, we are also having them in treatment for outpatient, psychiatry, or some additional supportive therapies. It never should be the only therapy that a client is receiving. If they are only getting medication, then they are not reaping the whole benefit of treatment. Now, medications can only be prescribed through a psychiatrist or a physician, and it's because they are trained and understand the medical model. So they're going to understand anything that can counteract or any side effects that are going to affect patients. On the other side of that as well, they also have to do the medication management because as counselors, we are unable to prescribe medication. We can aid with observation. We can aid with helping to understand what they or assess for diagnosis, but we cannot prescribe medications. And medications are complex. They also are not fast acting. They take up to 30 days to absorb in the system, and it can vary. Even after the 30 days, there may need to be a diet or a dosage change. So that's not something that a counselor can do, and only the prescribing physician will be able to accomplish. And then there also might be other factors that they have to take into consideration, especially if the client has any other biological issues, especially with like heart health, liver health, and other conditions. So let's understand a little bit about where biblical and historical medicinal practices take place, because sometimes we don't really look at the Bible as a source of medical intervention, but it does exist. When we look at James 5:14, it actually states that the responsibility for ourselves is to be the stewards of our own bodies. So we are in charge of taking care of ourselves and maintaining our health, whether it be through gut, mental, or physical. And so in James 5:14, it says, if you are sick, you are to go to the elders to anoint you with oil. And this is basically go to the doctor, go seek medical care. If whatever is ailing you, you cannot figure out on your own, you need a professional reference for aid. And there is historical evidence that medical interventions have been occurring since and before biblical times. We'll look at two of them in specific, but one is the Hebrew background of medical intervention. So in the Jewish traditions, they often used herbal, mineral, and animal byproducts to aid in treatment. And they were also really highly into preventative measures. So a lot of it had to do with personal hygiene and maintaining sanitation for where they lived. So we're talking about the rituals of hand washing and feet washing. There was even evidence that they would brush teeth. So everything was done in order to prevent disease. But if necessary, you were then to seek out someone who had medicinal talents to aid in your care. Now, on the opposite side, when we're looking at more the Greek and Roman, they actually understood that there were surgical and other methodologies that aided in care. So Hippocrates, I believe is how it's pronounced, he actually was one of the first to discuss chemical imbalances within the body. So he was able to understand that whatever, bile existed in the body affected one's health. Where the location of that was made the difference. So there was black, yellow, green. All of these had a different effect on what was occurring within the body. And while he wasn't into the chemical imbalances of the brain, he was already understanding that there is chemical forces within the body that do affect one's health. So when we look back at how God sees medicine, he actually already created medicine for us. If we go to Ezekiel 47:12, there's actually an example of a tree that was created, and the leaves of the tree were meant to be eaten and used for medicinal purposes. So healing and restoration have always been talked about throughout the Bible, and some of this is actually inlaid in what he has created for man to use. So this again goes back to that herbal, mineral, animal byproduct. All these things are to be used because he created them for us to be able to use in medicinal purposes. Now, there's also the other side of it. There's a lot of stigma that these should be all natural products, and that's true. But as science advances, we are finding that there are more synthetic availability that are a little bit cheaper. And even though synthetics are not natural, they are created. So talents of medicine are also something that God bestowed upon us. So that's another thing to take into consideration. Now, if we look at biblical texts, that origin of stigma about medicine, there really is no evidence whatsoever throughout the Bible that God denounces medical intervention. So it's really unsure about where the stigma occurred from, but it just doesn't exist in the Bible. So now that we've seen both the sides of the science behind psychopharmacology, let's look at how we bridge that with the metaphysical. So we have to understand that each discipline, they have a subjective view about what the experience of the self is, or personhood. So when we look at psychopharmacology, they're mostly focused on how do we feel or heal the physical brain and promote good functioning. Individuals cannot really maintain or continue therapies unless they have some ability to focus or find a baseline for them to be able to receive the ability to change. We also look at theology as focusing on healing the brokenness of personhood. So we have to understand that their lessons and parables and all these examples that we have throughout the Bible are actually to help aid bring someone to that same baseline. And both of these practices are looking at a holistic treatment. in 1 Corinthians 12:27 or 12 through 27, we look at the example of, yes, all bodies have pieces, but the existence of an individual is a holistic one. All those pieces make up one body. And it's not the healthy who need a doctor, but the sick do. So when we know somebody is sick, we know we have to examine what is physically going on with them, as well as mentally and spiritually. Each discipline has a desire to help relieve suffering of individuals. Nobody wants to watch someone else suffer. And especially if you're geared towards the wellness or even the medical model, you want to help somebody who needs it. We also have to look at the fact that spirituality actually does affect brain chemistry. Dr. Ferguson and his team actually did a study and saw that when there were individuals in a spiritual moment or had a spiritual connection, it actually changed their brain chemistry. It actually had an effect on the frontal lobe areas. There were also other areas that lit up. In the Buddhist cultures, it actually, meditation and prayer cause the calming effect that we see with the same thing with norepinephrine and the GABA. So we know that even just having spiritual moments can affect how brain chemistry works. So both psychopharmacology and spiritual intervention have an effect on the brain. We also are looking at Christian bioethics and experimental theology, which are actually two groups that are making a very strong attempt to create a dialogue between science and theology. They know the importance of both, and they know that the need for integration is required. So now we need to pay attention on how we continue that dialogue without creating a barrier between the two. So now that we've looked at what psychopharmacology is and how that it fits into a biblical model and how integration works with it, we also have to look at how it affects counseling, because counseling is another major component of treatment. But with counseling and treatment, there are certain considerations to take. So methodologies are going to be a big one. Most that work well with individuals who are using medications, either because of psychosis or other ailment, we want to focus on behavior change, creating an environment of acceptance, and then also we want to look at methodologies that help aid in shifting disordered thinking. So some of the ones that work best are CBT, motivational interviewing, Adlerian theory, and we can even go as far as integrating Christian integrative theory and Christian psychology to help build on some of the spiritual aspects opposed to just using secular methodologies. But there is something else that we need to take into consideration. Medicine is an aid, but it is not without risk. So when we do the informed consent and we do discuss things with clients, we need to tell them off the bat that, this is a collaborative process. You are going to be educated or educating clients about what the medicine will actually do for them. You'll probably not be in as much depth as a counselor, but it is worthwhile to understand what the process is of medication. And this will come in with professional collaboration. And you're going to be wanting to establish support. So a psychiatrist or a PCM will usually be the ones that give the medications. So they are going to be doing the medication management. You also want to have referrals to family therapy or any other type of supports, which might also include groups. There's also the understanding that we need to do a thorough evaluation of our clients. This includes collecting histories, understanding their medical background, and also doing thorough assessments so that when we do that collaborative care, we're able to have these discussions with the psychiatrist and the family therapist or whoever else is built in the support team so that we can best help the clients, because yes, the medication is an aid, but it is not the complete scope of care. Neither is just having supports in secular or spiritual backgrounds. there's going to be a collective effort, if possible, if we can build one, to help aid the client in treatment. The other part is this is a medical choice. So we have to avoid using professional influence. Even if we feel the medication is going to be like a huge thing, if the client doesn't want to take medication, we have to respect their choices. Continuing education is going to be another big factor. This can help aid in understanding like what products are out there, what's generic and what's name brand, atypical versus non-atypical, and then also understanding what the side effects are. And this may come from more having a discussion with other professionals, psychiatrists or PCMs about what these clients could face, but hearing it from more than one source sometimes can be somewhat validating. And then also we really have to think about the holistic treatment of an individual. We have to take cultural considerations in. We have to look at how their lifestyles are, if that's something needs to be changed, or there needs to be respect to systematic issues that are causing barriers. And then there's also the spiritual aspect. What concerns do they have about taking medication that are going to affect their spiritual life or those around them? Do we need to have a family discussion? Do we need to discuss stigmas? So these are all things that we have to look at to help aid the client in understanding what their options are and how well their treatment can go based on the options that they have. So although we only have a short time in this presentation, I do want to leave you some excess resources that may help to further your examination of psychopharmacology. So first is the Annual Review of Clinical Psychology that offers a great resource on the history of psychopharmacology and how it has developed over time. There's also the Marx Hirschfeld Museum of Medical History. They do a great job on looking at medicine from a biblical standpoint and the biblical histories of medical use. And then there is the Dr. Michael Ferguson TED Talk that we discussed, which basically examines how the chemistry of the brain works with spirituality and how when individuals experience a spiritual moment, it actually does change their chemical makeup within the brain. And then there's a great series on YouTube called Level Up RN. She is Nurse Kathy and has a lot of great resources on neurotransmitters and some of the medications that can be used to help aid patients. And then finally, there's the Biblical Counseling Coalition. They have great resources about experimental theology and some articles about the bioethics, or Christian bioethics to be specific. And this is the conclusion of my presentation. I hope you found everything that was shared incredibly helpful. And if there's any other questions or concerns, please feel free to reach out to me by email. And please feel free to go ahead and check out my references for any additional materials if you want to find out any more further information.